Muffy Walker, can you hear me?
Yes, your voice is clear, Muffy.
Good. Hi, everyone. Welcome and happy World Bipolar Day. Very, very exciting day. This is the second year. So I'm going to go through the presentation and then we'll have time afterwards for questions. This is probably what most people in the world think of about mental illness. And of course, these people do have mental illnesses, but there are also other pictures that we all know represent all kinds of brain disorders. Today, as was just recently mentioned, today is World Bipolar Day, March 30th. It is held on the birthday of Vincent van Gogh, who was posthumously diagnosed with bipolar disorder. And my organization, along with two others, started this World Bipolar Day, last year being the first. And we are having celebrations literally throughout the world with chapters and organizations all around the world participating in one way or another. There is a World Bipolar Day Facebook page that you can look at, and our Facebook page, International Bipolar Foundation, is showing pictures throughout the day of hundreds and hundreds of people who define themselves outside of their bipolar disorder. So why a bipolar disorder day? Because bipolar affects 27 million people worldwide. It's the sixth leading cause of disability in the world, and it results in a reduction of 9.2 years in expected lifespan. The vision of World Bipolar Day is to bring about world awareness to bipolar disorder and eliminate the social stigma, which I'm going to be talking a lot about today. Through this international collaboration, we will bring the world population information about bipolar disorders. Some other statistics that in the world there are 450 million people globally who suffer from a mental disorder in both the developed and developing countries. And according to the World Health Organization, almost 3,000 people take their lives every day, with suicide causing more deaths every year than homicide or war. I mentioned the bipolar being the sixth leading cause. There are 4 of the 10 leading causes of disability are mental disorders, with depression being number 1. In the U.S., which is where our organization is based, there are 26.4 people who have, of adults who have a mental illness. 46.3 are 13 to 18, 13.1 are 8 to 15. That's over 65 million American adults and 12.8 million children. Interestingly enough, that's 3 times all those with diabetes and 10 times all the cancers, if you took all the different cancers combined, 10 times. So what is bipolar disorder?
Muffy, I apologize for interrupting you, but your slides are...
How's that?
Yeah, we can see your slides. Thank you.
Okay, I'm sorry. I will just quickly, I'm not going to repeat all of this stuff, of course, but this is the graphic that I was talking about, how people are viewed with mental illness. This is the World Bipolar Disorder, World Bipolar Day logo. These are the statistics. So I was just about to talk about the actual symptoms of bipolar disorder. Bipolar disorder actually was called manic depressive illness for a long period. It only recently changed its name to bipolar disorder. It is a neurochemical disorder of the brain. It is heritable, which means it is passed on from generation to generation. And it can occur in children, adolescents, and adults. This mood disorder causes dramatic mood swings from, of course, overly high and sad to hopeless. And these periods of the highs and lows, as we all know, are called mania and depression. These are the actual symptoms of mania and what someone who is trying to diagnose a person or evaluate a person is looking for mania. Increased energy, activity, and restlessness, excessively high, overly good or euphoric mood, extreme irritability, and I'm going to come back to that one, racing thoughts and speaking quickly, jumping from one idea to the other, not being able to concentrate and easily distracted, little sleep, perhaps unrealistic beliefs in one's abilities and powers, poor judgment, spending sprees, a lasting period of behavior that's different from usual, increased sex drive. Actually, hypersexuality is often seen with people with bipolar. Abuse of drugs, specifically cocaine, alcohol, and sleeping medications. Provocative, intrusive, or aggressive behavior, and denial that anything is wrong. I said I would come back to the extreme irritability. This doesn't sound like that it would be a symptom of mania, but it is definitely a symptom of mania, and most often seen in children and adolescents who present with mania. They're not necessarily the happy, jovial, euphoric person. They might be extremely irritable and have episodes of what we call raging. Depression. So depression is more than what we talk about when we wake up and say, oh, I feel depressed today. This is a clinical picture of somebody who has poor appetite or is eating too much, sleeping too much or not able to sleep, nervous and worrisome, loss of interest in usual activities or withdrawal from these activities, feelings of sadness that just don't go away. They go on and on day after day. Also, irritability again, or restlessness and lack of energy. We don't always, but we often see feelings of sadness and worthlessness and guilt, people who feel guilty for something that they may have no control over, an inability to think or concentrate, repeated thoughts of death or suicide, chronic pain or other problems that don't respond to treatment, and increased risk-taking behavior, including reckless driving or substance abuse. There are a lot of myths about, of course, all of the mental illnesses, but I'm specifically going to address those about bipolar disorder. And a lot of people, believe it or not, don't believe that bipolar disorder is a medical illness like heart disease or diabetes. They just say that this person is crazy. When in fact, bipolar disorder, like any other illness you can think of, diabetes, heart disease, cancer, is a legitimate medical illness. And research does show that there are genetic and biological causes for psychiatric disorders and that they can be treated effectively. Bipolar disorder is the result of bad parenting. This is a very common myth, and I am the parent of a child with bipolar disorder. And I can't tell you how many times I had parents come up to me and tell me if I was just sterner with my son, if I punished him for doing X or Y. I even had a fire department, a bunch of firemen coming into a grocery store who told me I really just needed to spank him and he'd whip into shape. So we know that there is a genetic susceptibility, but being a bad parent does not bring about bipolar disorder. Depression results from a personality weakness or a character flaw, and people who are depressed could just snap out of it if they tried hard enough. And in fact, if any of you have experienced clinical depression, we know that this is not true. It has nothing to do with being lazy or weak. It has everything to do with brain chemistry or brain function, and we know that medication and or talk therapy will help someone recover. If you have bipolar disorder, you can will it away. Being treated for a psychiatric disorder means an individual has some way failed or is weak. This is a very common myth and one that brings about a great deal of unnecessary stigma. We know that a serious mental illness cannot be willed away and that ignoring the problem does not make it go away. It takes courage and strength to seek professional help. What if you thought maybe you had bipolar disorder or you have a family member or a friend with bipolar disorder? Who do you speak to about that? I would always suggest and advocate going right to the professional, the expert in the field, who would be a board-certified psychiatrist. If it's a child that you're seeking evaluation for, then make sure that that psychiatrist is certified in child and adolescent psychiatry. Just like you wouldn't go to your family medical doctor to have your breast cancer treated, you wouldn't go to your family medical doctor to have your mental illness treated. There's also testing that can take place. Neuropsychological testing will help the evaluator make a correct diagnosis. At this point, there are no blood tests for bipolar, although they are actually working on this. But if the physician wants to run blood tests, it's not that he or she is looking for a sign of bipolar. It's that they're probably trying to rule out any other reason that you're having these symptoms. And one of the most important pieces in making this diagnosis is the clinical interview with the patient, including a family history. The family history is very important. What if you have a loved one that you think has, you're concerned about? You don't know if they have bipolar, or maybe they're using drugs or alcohol, or they have another mental illness. So we can't ignore it. It's not going to help the person if you ignore it, and you're not going to be telling them anything they don't know. Clearly, if they're experiencing any of these symptoms that we just discussed, they already know something's wrong, and maybe they're just too afraid to reach out for help. So perhaps you can start by expressing your concern. Say something like, hey, it seems like you're going through a difficult time. How can I help? Or, I'm concerned about your safety. Have you thought about harming yourself or others? This, of course, is somebody that you're truly worried about who you may feel is suicidal. Find out if they're getting help. Maybe they're already in treatment with someone. Don't blame them. Don't go back to those myths and blame them. This is a biochemical brain disorder, not something they're responsible for. If you can, offer a plan. Reinforce that help is available. Perhaps you've already spoken with your friends or your doctor, and you know of a psychiatrist in your community or a mental health clinic. Offer that resource to the person, and offer hope and support. You can help the person with everyday chores, like daycare if they have a child so they can get to the doctor, or maybe they're not eating, so you offer to go and do some shopping for them. And really treat the person with respect, compassion, and empathy, just as you would if your neighbor had cancer. Treat them the same way if they have a mental illness. It is just another illness of another organ in the body. What is the treatment? Well, I think that most psychiatrists and physicians would agree that the first line of treatment is medication. Now, this is not necessarily so with everyone, but it is probably the first line, especially if the person is in crisis, especially if they're in a manic episode and they need to be stabilized, or they're in a depressed episode and they need to be stabilized. Once the person is stabilized, they can involve themselves in a talk therapy. The most common talk therapies that are used with bipolar disorder, and I shouldn't say the most common, but the most successful, are listed here. CBT is cognitive behavioral therapy. DBT is dialectical behavior therapy. And FFT is family-focused therapy. The first two are really helping the person challenge the cognitions or the thoughts they have that may be influencing their behaviors. You've probably experienced this yourself, where you pull up at a red light and you look over and the person in the car next to you looks at you and snarls and shakes his head, and you think to yourself, oh my gosh, what did I do? Oh, I'm such a bad person. Oh, I shouldn't have pulled up so close to him. So what else could have actually been going on? Maybe the man was talking on his cell phone to his wife and he's in an argument with her and he's just looking out the window, shaking his head with the snarl. So these are ways of challenging your unhealthy cognitions that impact the behaviors. And family-focused therapy is really been shown to be quite effective when the whole family gets involved in the treatment. Now, this is not always available, it's not always advisable, but your physician, your psychiatrist should be able to help you find the right form of talk therapy. There are, as well as individual psychotherapies, there are support group therapies where you might meet with a group of other people with psychiatric disorders or bipolar disorder and have support from one another. Diet and exercise and sleep are actually very, very important. And what we are seeing in the literature now is that those, and I mentioned earlier, that those with bipolar disorder, or the serious mental illnesses, I should say, which include bipolar disorder, schizophrenia, and major depression, they are unfortunately showing results that these people have a 10 to 20 year reduction in life expectancy. You would probably think that's due to suicide or risk-taking behaviors or side effects of their medication, but in fact it's not. It's due to the lifestyle. So what we're seeing, the reason for these people having reduced lifespan is because of obesity, a sedentary lifestyle, a poor diet, and they're getting heart disease, they're having strokes, they get diabetes, or they're not taking care of their wellness plan. They're not going to their family doctor for checkups and mammograms and colonoscopies, and they're not getting their teeth cleaned by the dentist to check for infections, etc. So this diet, exercise, and sleep are very important. There's a lot of research done on the sleep, and we know that keeping the circadian rhythm, the biological clock, in sync is very important. So it's important to have a consistent sleep hygiene and not 13 hours one night, 2 the next, go to bed at midnight one night, at 8 in the morning the next night. And I'm sure if you're interested in that and you just Googled sleep hygiene for bipolar, you would see a lot of articles. The last piece on here is structure, and that's not necessarily a treatment, but it's a lifestyle choice whereby we see that people with bipolar disorder do much better when they have structure that they can follow through the day. So at 8 o'clock I get up, I have my breakfast, then I do my exercises, and then I clean my room, then I go to work, et cetera, et cetera. And not that you have to rigidly stick to the structure, but if you have a structured lifestyle, I think that they show evidence that there's a much better lifestyle for that person. So what does bipolar look like? These are obviously people throughout history and who are in our movies today. Starting on the far left, for those of you that don't know any of these people, this is Carrie Fisher in Star Wars. Carrie Fisher is actually on our honorary board. And then Vivian Leigh from Gone with the Wind, Jane Pauley in the middle there, Linda Hamilton in a Terminator movie. That's the famous author Virginia Woolf at the top. Right below her, Ben Stiller, and then Winston Churchill, Richard Dreyfuss, and then far left, and my far left in the red is Mozart, Jean-Claude Van Damme, Catherine Zeta-Jones, and of course Vincent van Gogh. What does bipolar look like? Well, this is what it looks like to me. This is my son. This picture, he was 2, symptomatic when he was 4, and diagnosed when he was 7. So the point of the picture is bipolar doesn't look like anything. It's what human beings look like. We can't see it. You can't see it on an X-ray. You can't sit next to someone and know they have bipolar by looking at them. This International Bipolar Foundation was founded by myself and 3 other moms, all of us who have children with bipolar disorder. Our children are all now young adults. Our mission is to eliminate bipolar disorder through the advancement of research, to promote and enhance care and support services, and to erase associated stigma through public education. The organization is 8 years old now, and we have maintained our mission the same from the get-go. We are a nonprofit organization and based in San Diego, and we have an international reach. So we know that we are presently helping people in over 184 countries. All of our services and our programs are free, and they're globally accessible. Our website, in case you're interested in any of the resources, is www.I, B as in boy, P as in Paul, F as in Frank.org. And you'll see that there is a book on there called Healthy Living with Bipolar Disorder. That book is available as a free PDF download. You can also get it on Kindle, or you can order the hard copy. We have a library of over 70 75 webinars and lectures that range from scientific lectures to therapy dogs to stories of hope, lithium and ECT treatments, etc. And we do a lot of proactive education of the public. We are right now in the middle of our middle and high school essay contest. It's an international contest where students will write about various topics on bipolar and stigma. We started the first Girl Scout mental health awareness patch. We've reached over 6,000 troops, and we are in the U.S., Canada, and 3 European countries with that patch. We have several anti-stigma campaigns, one of which is called Say It Forward, and that campaign actually runs in October when America's Bipolar Awareness Day is. It's basically a social media campaign where we're educating people about bipolar disorder. This past year, over 1 million people participate in that campaign. So you can look on our website to see what some of the other resources are that we have. So I would be very happy to entertain any questions.
Thank you, Muffy, for your presentation. I would please request the participants to send their questions by using the chat function. Yes, you can send your questions by using the chat function to me, please. And then I'll read the questions to Muffy. We have already a number of questions, but before getting to the question, I want to highlight also that on global level, in 2013, May 2013, at the 66th World Health Assembly, the member states of the World Health Organization have adopted the Global Mental Health Action Plan, and bipolar disorder was considered one of the severe mental illness, together with psychosis and moderate to severe depression. And 194 member states of the World Health Organization have adopted that by the year 2020, there will be an increase of service coverage for people with severe mental illness will be achieved globally, for all people with severe mental illness, including people with bipolar disorder. So, Muffy, I can get to the question. We got a number of questions already. I can start by reading the first one. What is the possible role of service users and caregivers in raising awareness and management of bipolar disorder? Muffy, we cannot hear you. I think your mic is muted.
Can you hear me now?
Yes, we can.
Yeah. There's a lot of background noise of things moving around. Could you repeat the question?
What is the possible role of service users and caregivers in raising awareness and management of bipolar disorder?
What is the possible role?
Yes, exactly.
Okay. Well, there's quite a few pieces to that role. I think the primary and most important piece is educating yourself about bipolar disorder, and then educating those around you, because the stigma, unfortunately, is a huge obstacle to help-seeking behavior. So if people are feeling so stigmatized that they can't share with their family or their loved ones or their employer that they have a problem, then they're not going to get help. So I think the primary role is to educate yourself. If you have a working relationship, if you have a healthy, good relationship with the person, then I would advocate that you assist them in whatever way you can with their treatment plan. Now, of course, this varies depending on your relationship, the age of the person who has bipolar disorder, etc. But I would say that, A, to educate yourself about bipolar disorder and those around you, and then to participate in the treatment plan as much as the person is willing to allow.
Thank you, Muffy. And another question, what are your thoughts on using herbal and other traditional treatments for people with bipolar disorder?
Yeah, I am not a physician, so I cannot comment on whether they are good or not. We have several webinars, one of which is Advanced Nutrient Therapy for Bipolar Disorder with Dr. William Walsh. So if you just go to our website and in the search button put in Walsh, it'll bring that up for you. I know that there's literature out there that talks about using the omegas. I think that there's not convincing literature about St. John's wort. I don't think that they've found any success with that. But in my personal opinion, I think to have a well-rounded treatment plan is what's going to be the healthiest. So I wouldn't necessarily recommend only being on herbs or only being on medication or only being on omegas or whatever. I would advocate perhaps a well-rounded treatment plan that perhaps incorporates these various pieces. And again, I am not a doctor, so I cannot prescribe whether a person should take herbal medicine or not. There's another very, very good webinar on Jennifer Barr. Her name is Dr. Jennifer Barr. I believe she actually just did a live lecture for us. Yes. She's a licensed naturopathic doctor who specializes in homeopathic medicine for the mentally ill. And we have a couple lectures and webinars on our website with her. And she also wrote a chapter in our free book, Healthy Living with Bipolar Disorder. So whomever asked that question, you could get that book and read what she has to say about that.
We also got a question about using dance therapy or process work psychotherapy. And do you think these are helpful types of service?
Did you say dance therapy?
Yes.
Again, I think that anything that works, if it's not a hindrance to the person, yoga, relaxation exercises, dance therapy as a form of not only relaxation but also exercise and use of your creative self, all of these are part of a holistic plan.
Thank you, Muffy. I have also another question on models and examples for successful initiatives for management of bipolar disorder in low-resource settings.
I heard the low-resource city for bipolar, but I didn't hear the first part.
Yes, about management of bipolar illness, successful models for management of bipolar disorders in low-resource settings.
What is the question, though? I'm sorry.
It is successful models for management of bipolar disorders.
What are successful models?
Yeah, if you can give examples or share models that you have seen.
I'm sorry, I don't know what those might be. I think that each culture, each country has different cultures, and they all have a different way of handling that. I'm sorry, I can't answer that.
I'm happy to share our experience in WHO about this. One of the resources that WHO has been using in many countries is the Image Gap Intervention Guide. Image Gap Intervention Guide is a guide designed for training non-specialized healthcare professionals in non-specialized settings on treating some priority mental health conditions, and bipolar disorder is one of these conditions. This guide was used in many countries of the world, in most WHO regions. More than 84 countries have used it, and most countries that decided to use this guide has selected bipolar illness bipolar disorder as one of the priority conditions. And it was an effective model where the countries took a phased approach in implementing this guide, starting from adapting the guide to its local context, training of a group of trainers, and then training the health professionals with supervision and providing essential psychotropic medication and evidence-based psychotherapeutic intervention. This was implemented in many low resource settings, starting from Ethiopia to Libya to countries in Latin America, in several countries in North Africa. Mati, we got another question on the wide reach of the IBF, and that some of these countries are low-income countries with very low resources public healthcare system. And how does the reach of the IBF translate in these settings? And what does the IBF do in these areas?
Well, that's a very good question, and it's obviously something that we're constantly working on, trying to figure out how we can get our resources into countries that have little resources and perhaps don't have a computer where they can access all of these resources on our website, the book, the webinars, etc. We are in the process of communicating with an organization called World Books, and this is a way to get our book into the hands of third world countries. As you can imagine, it's a difficult process, and it takes a great deal of money to do so, of which we don't have that much of. So I appreciate that question, and all I can say is that it's something that we are working on. I don't have a specific plan at this point.
We got another question about family-focused therapy, and we have a request that if you can expand on this, please.
Well, family-focused therapy was started at UCLA under Dr. David Miklowitz. It is a form of therapy that involves the family, obviously. It's just a modification of what we used to call family therapy. All of the immediate families are included, and the therapy consists of different stages where the patient and the family are educated about their illness, they're educated about the symptoms and why they have the symptoms, they're educated about the medication, they're taught what to do if certain symptoms arise. They're taught to have a plan in order, if you will, if certain symptoms arise, whether it's going back to the doctor to reevaluate medication or going to an emergency room, etc. And then they talk a lot about the negative interactions in the family and how those negative interactions could maybe trigger the person with bipolar. And they come up with problem-solving skills to reduce that conflict or those negative reactions. Typically, I believe they say that it typically lasts for about 9 months, although that might be shorter now with all of the issues around insurance, about 21 sessions. And of course, that all has to do with what your insurance or you can pay for. But that's what a family-focused therapy is in a nutshell.
Thank you very much, Muffy. We don't have any more questions, so I would please request you to, if you want to provide the final comments before we close today's session.
Well, I just thank everyone for attending this webinar. It's always great for people to educate themselves, and hopefully you can pass on what you've learned to others. Go for World Bipolar Day, go out there and educate one person about bipolar disorder so that we can help break down the devastating effects of stigma. And thank you.
Thank you very much, Muffy. And I would like to remind everyone that this webinar will be available as a recorded